I introduce you Mahmood Adil, which is the Medical Director of Public Health Scotland and also is the National Clinical Data and Digital Lead of the Royal College of Physicians of Edinburgh. So Mahmood, over to you, and thank you for being here with us, all of you.
Thank you, Paul. Just to check, can you hear me?
We can. Well,
right, and you can see my slides.
Not yet for the moment. Are you sharing?
Yes. Can you see my slides now?
It's perfect, Mahmood. You can please proceed.
Right, thank you, Paul, and a very good afternoon from Scotland. And it's my privilege to be talking to you all on this forum. I wish it could have happened face-to-face, and I would have heard and met the Honorable Secretary of State. But I've been asked that I should be moderator for what stream B and D. So I would like to share some of my thoughts, which can pave the way for some of the discussions going to happen today and tomorrow. So let me say that the stream B is about the getting about personalized care, and the stream D is about the collaboration between the health systems. And both of them have been part of my job. I'm a medical director for Public Health Scotland, and I've also been the international representative working with a number of countries to build a relationship between the UK health system and a number of other countries. So the first thing I would like to say that this is, I personally very much believed in, the time has come that we need to move from stethoscope to datascope. What does it mean? Actually, this is my personal journey as well. Years back, I was a clinician having stethoscope around my neck, and then I was seeing patients. Now, after maybe 15 years, I am the responsible for most of the data and intelligence in the country, and I see that I can and my colleagues can make the biggest impact on the health of the people, which is 5.3 million people in Scotland. So that's the first point, that the things have changed. It means that 70% of our NHS beds are occupied by chronic diseases, and the chronic diseases need to be managed with better understanding of those patients with the data rather than just using our stethoscope. So we need to use data as effectively as we use stethoscope. And the second point I like to make, that in our medical schools and in our educational institutes, which help the new workforce, they don't have much training about the understanding of data and using it. And that's another mission I have taken as part of the Royal College, that all of our future doctors and nurses, they should have the good understanding how to access, use, and use the data so that they can make a difference in patients' lives. Talking about personalized healthcare, actually, the question is that we do all healthcare system, including Portuguese and in Scotland, UK, number of other countries who are listening today, they do collect a lot of data. But we use the data most of the time for descriptive analytics, actually looking at what has happened, how many patients have diabetes. But the real benefit of the data and the technology come when we can do the predictive analytics, which means what will happen, or even better with help of artificial intelligence, the prescriptive analytic, that what is the best outcome and how can we make it happen. And COVID-19 is a good example, that if we keep looking at that what has happened in the past, unfortunately our patient will keep dying, and we need to start predicting and started doing the prescriptive analytics. Then here's a good example of how we deal with data in Scotland. So if you look at this basket, we put all of our data in an example in a basket, and then whatever questions we have, then we can link the data with our CHI number. This is a unique identifier for every person who lives in Scotland. And then we can try to get the answers. And there are new data sets are coming on board, like genomic data is coming, variable data is coming, and we need to be mindful that in addition to the routine data we all health system collect, we need to start collecting the new data sets so that we can use it in order to improve the health outcomes. I have used the word health, not the healthcare. And this is very, very important for all of us to understand, Health means physical, mental, and social well-being. We also know that our clinical services usually only add 20% into our health, and the rest of them is come from our own behaviors as well as from social determinants of health. This slide shows that in Scotland, we divided the country into 6,976 data zones. And in each data, we collect data on income, employment, education, access to services, crime, housing, and a number of other things. So it means that we have got a better understanding of the people who are living in those data zones, and we can do social marketing, and we can use the big data to improve the health, not only the healthcare. So as I said, the global health and the global interaction on data and improving the healthcare system by working with other countries have been my mission over the years. And I feel that if this forum can help us to create value through international partnership, we need to take 3 points into mind. First of all, most of the health systems and organizations are data rich and intelligence poor. It means we do collect a lot of data, but we cannot change into intelligence which could be used by our professionals, managers, policymakers, and media to take some action, of course, public and patient, to take some actions to improve health outcome. So we need to shift from the rich, data rich to intelligence rich. Second thing, we do collect a lot of data, the volume, but we need to think about how best we can change into value, and I will come back to it later. And I think we need to build data-driven innovation partnerships. And when I talk about global health data partnership, basically it means we should have the ability to access, understand, use, and share data to improve health outcomes. So if we can develop partnerships which can improve health outcomes across the globe, it means that if we save a life, it is like saving the whole humanity. It is not like just saving a life in Portugal or in Scotland or in Argentina or in America. If we can share our forces, we can save millions of lives, not only about the COVID, but also about the number of other challenges we are facing. COVID-19, what it has done, it has actually brought us on one platform. And I think we need to keep building on it so that we can build a data partnership which can improve health outcomes. So when I say value, I think respected the Secretary of State did mention about the value and outcome. To me, whatever we do as a result of this forum, we need to keep in mind if those data partnership does not lead to one of those 5 outcomes, then it means they are not creating value. The first one is quality improvement. It means patient safety, the effective treatment. Second is performance management, efficiency of the health system. Third one is we need to start thinking about the benchmarking local, national, international levels. Then, of course, improving health policy and planning in order to have the long-term impact. And then last but not least, which is very pertinent, is the innovation and research. And I think it is a very important platform which we have started today, that we need to start thinking how best all the countries and all the organizations who can work together to improve innovation and research. And I would be delighted to be part of it. So let me say thank you. And once again, I appreciate having the privilege to be the moderator and to be having the ability to speak today at this very, very important forum. And my email is there, and I would be delighted to have future interaction with all of you. Thank you.
Thank you so much, Mahmood. I think you are now leading